afternoon, everybody. This is Jessica Trick with Cornerstone Physical Therapy. Today I wanted to take a little bit of time and talk to everybody about headaches. What type of headaches that occur, what symptoms you might feel from these type of headaches, and what physical therapy could do for headaches depending on what type of headache you have. So we all may experience headaches that we feel are very sinus related, especially during allergy season when things are blooming. The typical presentation of a sinus headache is pressure kind of right through here and a little bit above the eyes. You may feel congested, like you can't breathe fully through your nose. It may cause some pressure into the jaw or into the temporal area, and it's just from some congestion where things are just off a little bit and you're not getting full kind of circulation of air through all of these areas. So with sinus headaches, in regards to physical therapy, it's not a typical headache that we typically treat in physical therapy, but there are some releases that we're able to do through this area to relieve sinus pressure if you're having other types of headaches involved also, or if you just happen to come in one day, we're treating you for neck pain, and you're like, man, I'm just having this killer sinus headache. There's some releases that we know as physical therapists that can release some of these canals for sinus pressure and alleviate some of those symptoms. But once again, not a typical headache that most people are going to go get physical therapy for, because they're usually during certain times of the year, during allergy season. They last for a couple days, maybe a week, and then they resolve because your sinuses feel better, or whatever's in bloom during that time stops blooming and goes away. More typical of headaches that we'll see within the clinic would be migraines, cluster headaches, neck or cervicogenic headaches, and tension headaches. So I'm going to give you a little bit of description of the presentation that you might feel when you have these type of headaches. So we'll start with a migraine. A migraine headache is very unilateral in nature. So it's going to kind of almost divide through the face, and all the pain's going to be on one side. It may affect your head on that side, your jaw, your eye, and even your neck. Migraines are typically present as like a deep, dull, throbbing type pain of a headache. The muscles along that side of the neck may be tight, or we may see tightness on the opposite side just from some compensation. So in general, if you feel like you have a migraine, it's going to be on one side of the face. Could affect all the structures on that side of the face. It doesn't typically cross over to the other side. In similar aspects, a cluster headache is also going to be typically on one side and usually focuses into the eye. So what we'll see with this in physical therapy is somebody that's complaining of some deep, more orbital eye pain, and that relates to some muscles more into the suboccipital area that we kind of palpate on, that we feel on. We might do some dry needling. With any of these type of headaches, what we're looking for is the presentation that you feel, the frequency that they're occurring, the intensity that they're at, the duration, how long are they lasting, and how many years or how long of a time span have you been dealing with these symptoms. All of these are going to kind of be a predictor for how well you're going to respond to physical therapy, how long your treatment plan may be or have to last to kind of subside and resolve some of these symptoms. And we may not be able to get rid of all of your headaches, but our goal for physical therapy in regards to our headache patients is to help you feel more in control of that pain, help you manage your symptoms, and give you the tools that you can do to offset these symptoms from coming on. Sometimes with cluster headaches, they're very cyclical in nature. So you may have to start a diary or track of like what times of year, or is it around a hormone cycle that these headaches onset. So then you know you can kind of get ahead of the curve and start doing some exercises and stretches to alleviate these symptoms. Another type of headache that we see is tension headaches. Tension headaches are going to resolve more along the frontal lobe and into the temporalis muscles. These can come from clenching the jaw if you feel like you've been under stress, either emotionally or physically, whatever may be going on in your life. They may also create a little bit of tension in the neck. So as for physical therapy, when we're talking about tension headaches, we're trying to identify factors that are, bringing this type of headache into your life. Do you clench and grind your teeth at night, and it's causing a lot of pressure into your temporalis and your muscles, your masseter muscles, and you start to get tension across the forehead? Do you have a really stressful job? Do you have a lot of kids, or just anything going on in life that can correlate to tension headaches is what we kind of want to identify when we're treating these. We work on a lot of muscles through the head, through the back of the head. A lot of these headache symptoms as far as treatment will overlap in some ways of that. We're always going to address, muscles in the jaw for tightness, muscles in the neck for tightness, cervical range of motion. How far can you turn? How far can you look up and down? How far can you bend your head side to side? And if we see extreme limitations in one range versus another, those are areas that we're going to identify and treat as far as joint mobility, myofascial mobility, to try to get things moving better, to loosen up the areas in your neck, even down into your shoulders and your mid-back, to relieve the tension, to alleviate these headaches. The other type of headache that we see a lot in physical therapy is like a neck headache, or another term for it would be cervicogenic. So this is a headache that is usually felt either at the top of the head or at the back of the head. And a lot of times the origination from this type of headache is coming from pain in the neck, limited neck range of motion. You can't bend too far this way, or this is as far as you can go, or you're like, this is as far as I can turn this way. So we're looking for more neck symptoms with these type of headaches. You feel it in your head, but it's originating from a neck structural issue, not as similar to like the migraine cluster headaches that you feel in your face. So with any of these type of headaches, we want to go through a full evaluation. We want to get a complete history of how long have you had these headaches, what symptoms do you feel on a regular basis, how frequently are they occurring, and then develop a treatment plan based on what we find in your evaluation. So if you find yourself struggling with any of these types of headaches, migraines, cluster, tension headaches, neck or cervicogenic headaches, a physical therapist can be very helpful in identifying what type of headache you have and treating these conditions to help you feel more in control of your symptoms, so that you're not having to deal with these chronic headaches, chronic migraines, month to month. Even some people are experiencing them every day. You may have been through going to an ENT, you have gone through sinus surgery, you may have seen a chiropractor, but don't forget about your physical therapist. We treat the body more than any other type of medical professional. We know all the muscles, all the joints, ligaments, and attachments, and can do a very thorough examination for you to help you get control of your headaches. Once again, if you have any questions, you can reach out and call us at 828-684-3611. And if you watch this Facebook Live feed later and you have any questions, you can comment on it. You can reach out to the clinic. We can have a physical therapist talk to you about your headaches and see if it's physical therapy appropriate. I hope everybody has a good day, and thank you for your time.